Donepezil Hcl Odt is a medication used to treat confusion, dementia, related to Alzheimer's disease. It does not cure Alzheimer's disease, but it may improve memory, awareness, and the ability to function. This medication is an enzyme blocker that works by restoring the balance of natural substances, neurotransmitters, in the brain. It is usually taken once a day before bedtime. The dosage is based on your medical condition and response to treatment. It is important to take this medication regularly in order to get the most benefit from it. Before you start taking Donepezil, make sure to read the patient information leaflet from your pharmacist. When handling the medication, be sure to have dry hands and do not remove the tablet from its pouch until you are ready to take it. Place the dose on your tongue where it will quickly dissolve and then drink a glass of water. Typically, this medication is taken just before bedtime, with or without food. If you experience sleep problems, talk to your doctor about switching to a morning dose. The dosage will be based on your medical condition and the response to treatment. Your doctor will start you on a low dose and gradually increase it. It's important to take this medication regularly at the same time each day to get the most benefit from it. If you miss taking Donepezil for 7 or more days in a row, talk to your doctor before starting again. And remember, do not stop taking it unless your doctor instructs you to do so. It may take several weeks before you get the full benefit of this drug, so be patient and consistent with your dosage. If you have any concerns or notice that your condition worsens, be sure to inform your doctor. As your body gets used to taking Donepezil Hcl Odt, you may experience some side effects such as nausea, vomiting, diarrhea, loss of appetite/weight loss, dizziness, drowsiness, weakness, trouble sleeping, shakiness, tremor, or muscle cramps. These effects typically last 1 to 3 weeks and then decrease. If these effects persist or worsen, it's important to notify your doctor or pharmacist. It's essential to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential risks of side effects. Most people who use this medication do not experience serious side effects. However, if you do have any serious side effects, such as trouble urinating, severe stomach/abdominal pain, black stools, vomit that looks like coffee grounds, or seizures, it's crucial to inform your doctor right away. In the case of very serious side effects like slow/fast/irregular heartbeat, severe dizziness, fainting, or signs of a serious allergic reaction such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing, seek medical help immediately. It's important to note that this is not a complete list of possible side effects. If you experience any other effects not mentioned, it's best to contact your doctor or pharmacist. If you're in the US, you can call your doctor for medical advice about side effects, or report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can call your doctor for medical advice about side effects, or report them to Health Canada at 1-866-234-2345. Before taking Donepezil, it's important to let your doctor know if you have any allergies or if you are allergic to it. This medication may contain inactive ingredients that could cause allergic reactions or other issues. Before starting Donepezil, make sure to inform your doctor about your medical history, especially if you have breathing problems, fainting, seizures, stomach or intestinal diseases, or trouble urinating. It's important to note that Donepezil may cause dizziness or drowsiness, and using alcohol or marijuana can increase these effects. Avoid driving, operating machinery, or anything that requires alertness until you can do it safely. Limit your alcohol intake and talk to your doctor if you are using marijuana. Donepezil may also affect the heart rhythm, causing a condition called QT prolongation, which can lead to serious symptoms that require immediate medical attention. This risk may be increased if you have certain medical conditions or are taking other drugs that may cause QT prolongation. Be sure to discuss all the medications you are taking with your doctor. Low levels of potassium or magnesium in the blood may also increase your risk of QT prolongation, so talk to your doctor about using Donepezil safely, especially if you are using certain drugs or have conditions like severe sweating, diarrhea, or vomiting. If you are an older adult, be aware that you may be more sensitive to the side effects of this drug, especially QT prolongation. If you are pregnant, discuss the risks and benefits of using this medication with your doctor. It's also important to consult your doctor before breastfeeding, as it's unknown if this drug passes into breast milk. It's important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. Always keep a list of all the products you use and share it with your doctor and pharmacist. As for specific interactions, be cautious of using aspirin or non-steroidal anti-inflammatory drugs, NSAIDs, like ibuprofen or naproxen alongside Donepezil Hcl Odt, as this could increase the risk for stomach or intestinal bleeding. If you are prescribed low-dose aspirin for medical reasons such as heart attack or stroke prevention, it should be continued as directed by your doctor. Always consult your healthcare professional for more details and to carefully check the labels of all prescription and non-prescription medications for any potential interactions with Donepezil Hcl Odt. If you suspect that someone has taken too much Donepezil Hcl Odt and they are experiencing serious symptoms like passing out or having trouble breathing, it is important to call for emergency help immediately. In the U.S., you can call the local poison control center at 1-800-222-1222. In Canada, residents can call their provincial poison control center. Symptoms of overdose may include severe or persistent nausea/vomiting, excessive sweating, very slow heartbeat, slow or shallow breathing, and seizures. It's important to not share Donepezil Hcl Odt with others. Your doctor will need to periodically check your weight to monitor for any potential side effects. If you forget to take a dose, just wait until the next scheduled dose. Do not take 2 doses at once to make up for the missed one. This medication should be taken regularly at the same time each day. It's important to store Donepezil Hcl Odt at room temperature, away from light and moisture, but not in the bathroom. Make sure to keep all medications out of reach of children and pets. When it comes to disposing of the product, do not flush it down the toilet or pour it into a drain unless specifically instructed. Properly discard the medication when it is expired or no longer needed, and consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.